Poso maoni wiak, waiwanan kitana ni mua e yoski piataya posnotaman e yum MITW podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Mapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. And I would like to remind people that request that you send in your COVID-19 related questions into us via email at podcast@mitw.org. Welcome, Vaughn.
Thanks for having me back.
Okay, so this week there was a revision in CDC guidelines. Was there actually a revision? Because I know that they had put it out and then they took it back. And is it actually revised now?
Yeah, so
I'm confused.
The CDC, they did put out some updated information. As far as guidelines go, they didn't. They may have updated and then retracted it. So the standards for like social distancing and mask wearing and stuff are the same as they had been. Little to no change. They did say that the World Health Organization, or the WHO, did update some of their stuff. So some of the international standards have changed. Doesn't really affect us here on the reservation, but they are looking into changing some of the mandates and recommendations.
Can you talk about what that is in regards to?
Well, they're finding that transmission of COVID isn't it isn't a long range, or at least they think at this point it isn't a long range transmissible respiratory condition. So there are things out there like measles, which, you know, when someone breathes it out, it stays in the air for a really long time. And they can be a significant distance away from you, well over, 10 to 20 feet, and someone can contract it. They're finding that that's not necessarily the case with COVID, and they're thinking it's much more of, they say, 1 meter with the WHO, because they're international. That's 3 feet for those of us who use real measurements. And, the CDC is still recommending, 6 feet for physical distancing from individuals. So that's what they've been looking into as far as how long it stays within the air, and if how quickly air circulation and things like outdoor winds remove the virus and make it safe for you to breathe again.
I have seen some people saying that the gators, which you didn't know what I meant when I sent you this question.
I didn't.
So
I was like, what's a gator?
I was like, maybe I should explain what this is. But it's those kind of masks that people wear where it's kind of like a tube around your neck, and then you pull it up over your mouth. I had heard that those are less effective than other masks, and actually that they're worse than wearing no mask. Is there any truth to that?
Yeah, so initially I literally thought it was the reptile, and I was like, why are we talking about gators and COVID? Yeah, they are worse than a regular mask, particularly any type of mask that has a metal piece that seals around the nose. They also don't seal around the mouth. There's not a lot of data around them, but they do also collect like sweat and oils from your neck, since they hang down farther than a regular mask would. It's not necessarily COVID that they're catching. Could be bacteria or other viruses and stuff, but we don't recommend using them. Professionally, I can't endorse them as an epidemiologist due to the lack of data, but the initial stuff we've seen shows that they're not an ideal option. And I can't say for certain whether or not they're better than no mask at all. But I would discourage using them at this point until we find out more about them.
So I've heard a lot of people claim this for quite some time, but it's kind of been brought to the forefront again because President Trump tweeted this, I think, or posted on Facebook. I don't know. So he had said that the flu is more dangerous or has a higher mortality rate than COVID-19. Is that true or false?
So that also is a great question to ask right now, because this week the World Health Organization came out with new estimates regarding how many people have actually been infected with COVID. And they're saying globally it could be as high as 750 million people. So if that's the case, that means the 1 million people that have died from COVID, they are still dead, which is a sad situation. But it means the fatality rate of the disease is significantly lower than we initially thought. It's if that number is true, it would be closer to a 0.019, which is right around the flu, versus a 2 to 3% like we're seeing. Now, kind of a side note on that, the U.S. has the most stringent testing regulations in the world. So you could test positive for COVID here in the U.S. and another country might not consider you COVID positive. So people that, would be tested here could be positive. So there may be a wider spread globally than we initially thought. In any case, we're still kind of working on those numbers. A lot of the antibody testing suggests that the disease is also wider spread than the current viral testings that are out there. So it may have a lower infection rate, but we're still working on making sure those numbers are accurate. If it is lower, that's fantastic. One thing we have found, though, is because of the precautions that have been put in place, nationally, the transmission rate has actually been far lower than we initially thought. In some states, and I think including in Wisconsin, instead of a 2 or 3 transmission rate, we've brought it down to about a 1.6, which is fantastic, because that means the rate of new cases will slowly climb. And if we can keep working on prevention techniques, washing hands, face masks, social distancing, we might be able to turn that trend downward a lot sooner than we initially thought. So there is possibly good news. We'll get back to you on that one, though.
All right, we're getting closer to Halloween, and I was just wondering, will there be house-to-house trick-or-treating this year?
So we couldn't endorse house-to-house trick-or-treating this year at Incident Command because that's a great way to transmit germs across the community. One of the options we are looking at right now is kind of a drive-through Halloween event where a family can go take their kids and receive a small bag of trick-or-treating candy and stuff for each child with them, and that way it would decrease the amount of person-to-person contact. So we're looking at that right now. I believe that's in the planning stages, and we'll have more details on that to come.
All right, and then what are some other safer options besides trick-or-treating that parents can do?
You can always do stuff with the family. I know some people were talking about doing the backyard carnival thing with the Shawano Fair and also with Halloween. I always enjoyed the donut on the string and bobbing for apples, but I did not like that one where you had to put your hand in something you couldn't see. I have a very sensitive gag reflex, and that always gave me the willies as a kid. Just keep that in mind. But that's something you can do with your kids. So, be creative, do something fun, celebrate with family.
And then also, hunting season is here. I know that some hunt in big groups and some are lone hunters. They go hunting alone. I was just wondering, what are some ways that hunters can help stop the spread of COVID?
Yeah, if you're hunting with groups, definitely stay spread apart from your group. And if you're camping, consider using individualized tents, campers, or sleeping bags, so you're not in a confined space like a tent with several other people that aren't members of your immediate household. Also, make sure you keep washing your hands. I know sanitation can sometimes be a challenge when you're out in the woods, but if you can't wash with soap and water, make sure you have hand sanitizer with you, and try not to touch your face or be around your hunting buddies. So those would be the recommendations, pretty similar to what we're asking people to do in the community anyways.
What impact does Governor Evers' emergency orders have? Was that yesterday that that was released, or he
that
announced
his new order came out. So technically, the tribe isn't under any sort of regulations or requirements to follow state law. That said, the Incident Command has been trying to match state regulations as much as possible, and stay in compliance with what's being asked. In the event that we don't feel that the state's recommendations are, I guess, stringent enough or take enough precaution, the tribe and the IC team has the right to implement its own rules and regulations and stuff in addition to or in complete opposition to whatever the state says. So there are some bearings on what the tribe does. Long term, though, we're gonna probably follow those recommendations that the governor has put out, so that individuals that may come from outside of the reservation area will be familiar with what's going on. That said, we do have things in place that the state can't put in place, like the curfew and stuff to help decrease house to house transmission. So yeah, does it you feel that answers your question, Sheena?
Yeah, it does.
Awesome, great.
Thanks for joining us, Vaughn, as usual.
Thanks for having me again. Appreciate it. And stay safe and healthy out there, everyone.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn, and we do welcome any community questions you have regarding COVID-19, so please send those into us via email at podcast@mitw.org.